Hi everybody, Jennifer Gularson and Dr. Neil Spiegel here to talk a little bit about the anti-inflammatory diet. It's something we talk about all the time to patients, and we just want to give you a little bit of information about it. We're here seeing patients, but we're social distancing for the video. So Dr. Spiegel, how many times a day do you think you talk about anti-inflammatory diets?
Well, I talk about it a lot because patients ask me, what should I do when I have joint pain or joint swelling? And is there any foods that really I should stay away from or avoid? And the answer is yes. And I usually come up with the anti-inflammatory diet.
All right. So if you had to explain to a patient why the anti-inflammatory diet works for joint pain and lots of other things, autoimmune disease, gut problems, that's hormone imbalances, why is that?
The problem with most foods when they're quote-unquote inflammatory is that your body has to use certain nutrients to detoxify them. So if you're eating foods that are healthier for you, like whole vegetables, foods that aren't processed, etc., your body doesn't have to waste their nutrients detoxifying them, and it could deal with the other problems of your body, whether or not it's an autoimmune process or a joint problem, etc.
So you would say we only have so much available energy, if you will, to deal with certain toxins, and you're adding these crappy foods on top of that,
Right.
and you're just overwhelming your system.
Correct. And everybody's different, right? There's some people that can eat really crappy food and be fine, and there's some people that eat just a little bit and they're miserable.
Right.
So it really depends upon your own body. And I always tell patients, look, if you're consistent with the diet, an anti-inflammatory diet, most of the time, you could cheat every once in a while. So you don't have to be so committed every single day. But the things that I like to say is when you're using or considering an anti-inflammatory diet, the things you want to stay away from are bad fats, which are called trans fats. There's no question that these fats will kill you. When you talk about animal fat, you want to stay away from farm-raised fish. You want to eat wild fish. You want to stay away from regular steaks. Try to eat grass-fed beef. You want to stay away from regular chicken and try to go towards organic or free-range chicken. Again, the concept is if it has toxins in the food, your body has to actually process that.
Yeah, so you want to eat healthy proteins.
Correct.
They were healthy when they were living.
Right. Sugar is very inflammatory.
And that's a big one for our patients. So.
And sugar, the problem with sugar is it tastes good. The other problem with sugar is it kills you. So you have to have a little balance there. My general rule of thumb is if you don't have a problem with sugar, you're not diabetic, 30 grams a day, 30 grams of sugar a day. If you do have a problem with sugar, that number needs to be under 20 grams of added sugar a day. And that includes processed carbs, which we need to stay away from for the most part. But if every once in a while you're having that, you just have to kind of lower the load.
So make your plate smaller. And that's something I read the other day is look at how big our dinner plates have gotten. If you take a salad plate and put your dinner on it, that's probably what we should be eating. So okay, you said the trans fats, sugar, and then there's another big one you try and get patients to avoid, which is easier nowadays because the grocery stores carry more things.
Well, you have two major categories. One is gluten and the other one is dairy. So let's tackle gluten first, right? So gluten, the main reason that we tell patients to take gluten out of their diet is not because they're quote unquote allergic. Most people aren't allergic to gluten. The problem with gluten is that it has toxins in it because the farmers sprayed the wheat with what's called Roundup. And we now know that Roundup is tied to certain illnesses, a certain type of lymphoma called B-cell lymphoma. So again, certain people have sensitivity to be able to detoxify that substance, and the Roundup in our bodies could be toxic to some people. And that might present itself as an autoimmune disease or joint pains or
stomach issues,
etc.
And then another big one for people is dairy.
So dairy is tough. I mean, I would say what's interesting with dairy is certain cultures, it should be like avoided like the plague. Asian population, I would say it's almost 100%.
They have difficulty breaking it down, and they have stomach issues.
I'm Jewish, so Jewish people, I think the number is about 70%, which is a pretty big number. But dairy, the problem again with dairy is a separate issue, and that's the fact that there are hormones of a cow in dairy, which basically means it's not for human consumption. There is no animal on the face of the earth other than humans that drink or use processed or dairy products or milk products of another animal. We are the only ones. And we are the only ones that never wean off milk. But the reason to have a mother's milk is because it helps our immune system, it helps with growth hormones, et cetera, for the baby. We don't need that after we get to a certain age. So basically what we're doing is we have to detoxify that. So it's inflammatory.
So those are really good tips, and you're sort of on your way to an anti-inflammatory diet. If you have any other questions, feel free to email us or call our office if you wanted to maybe have help us guide you through an anti-inflammatory diet, and especially if you have a chronic disease, it's something that you should definitely follow. So please like us on Facebook and follow us on Twitter and Facebook, and that's it.
And one more issue with the current healthcare crisis. The major problem we have with COVID and the people that are actually getting very ill is an abnormal inflammatory response. So if you go on an anti-inflammatory diet, it will decrease the
it'll make you
likelihood
more resilient.
Right, yeah. More resilient, exactly.
Great. Have a good week.